Hi, I'm Dr. Justin Lin, sports physical therapist at Rehab and Revive. Do you have what you might consider a muscle tear? Or has a health professional mentioned you might have a grade 1 or maybe even a grade 2 tear? What's all this mean? In this episode, we will discuss what happens in a tear, how do we grade tears, and when you have a full tear, why is it bad? And lastly, how to salvage a partial tear, or at least give ourselves a small fighting chance to heal ourselves, despite what the naysayers might say or some might believe is impossible. First off, what happens in a tear? I think it's pretty straightforward. Something that was once together like a muscle belly has ripped apart. Anyone ever eat a Vietnamese spring roll and tear it apart? The muscle fibers inside a muscle belly are like the stuffing on the inside of the spring roll. What once had form and was easy to hold is now spewing out with things and the integrity is lost. So how do we grade tears? A grade 1 tear is a stretched muscle that has often small muscle fibers that are torn. A grade 2 tear is a partial tear to the tendon or muscle belly. Usually it's the muscle belly. However, it can happen to tendons if there's been previous injury or tendinosis, a degenerative process to the tendon. And a grade 3 tear is a full, complete tear of the muscle or tendons. Yes, when you have a full grade 3 tear, it is bad. The muscle joint isn't connected and that function or action won't work. So let's talk about how to salvage it yourself if you have a partial tear. Don't stretch it. You might feel the urge to do this, but don't do it. You will disrupt the process of healing. You'll want to promote that healing environment and lay down the framework of tissue healing before you start stretching and strengthening, and ultimately using it again with sport or activity. So we're gonna get to the demo right now. All right, so let's just say we have a biceps tear. I've actually had other tears in my shoulder, the rotator cuff, so you'll see that scar. So what you want to do is you want to hook your fingers like this, keep it even. You want your two tips, you don't want one more than the other so you don't stress. And I just kind of cross it like that. So that way it's just, and your job is to irritate that tear. So it's counterintuitive. It might be more painful in the beginning than it is pleasurable, I guess. So you're trying to provoke inflammation. Inflammation is like the sticky glue that's going to help glue some of the edges together. I know I might get fried by some of the little hardcore medical doctors and hardcore physical therapists say this is impossible, but you're creating your own like growth factor. You're creating your own like glue, and then what you're doing is you're taking those edges and bringing them closer together. Now, what happens, the process of that is you're creating a little soft muscle callus. You have a soft callus that happens with bone fracture repair. We'll flash that image. You'll start feeling over time, maybe 2 to 3 weeks, that there's a little mound growing. And inside that mound, the fibers are doing this, and they're coming closer together. And, you're hoping that link up. And you're creating some of that scar tissue in different arrangements. But the fibers, ideally, if you bring them closer together, they're going to start working together and make a bridge. So that little soft callus is important. Over time, that soft callus goes down, and then you just have scar tissue. Scar tissue is going to be good right now. Most of the time I say scar tissue is bad, but we want scar tissue to be able to protect you from that way the integrity is better. And then we can go use this friction massage and continue to do that and align it. And we'll show you that with a bunch of straws, how if they're all disarranged, you keep doing the same angle, they're going to start aligning themselves. All right, so the idea of the cross friction, imagine if you got this unorganized tissue that's been created from you creating the scar tissue from the friction massage. Over time, let's just say I want to take it that way. You can see that, things start kind of falling in time. They start going more parallel and that's kind of what our goal is. So once again, if I kind of organize it this way and I want to go up, over time, you're going to start getting the fibers to, go the way you want it, right? And so that's what we want is these nice striated angles, so once again, something like that you can kind of see. So yeah, that's basically what we're going to do. So if you have a partial tear, then give this a shot. You know, like what's the harm in that, right? So, but always check with your healthcare professional. So, like I said, you want to get the fingers there, and if the tear, usually tears go this way. So if this muscle belly goes this way, a lot of the times that's where the tear is. You can just kind of find that it's usually like, it's almost like a cavity or something like that. You touch it, it's like, oh, that hurt, it's sensitive. You might think it's tendonitis, it's probably not, because there's usually a little divot, like a punch out. That's where the tear has happened. You can feel that little ridge. So when you start doing that, and you're gonna strum it, you're gonna be pretty aggressive, and you're just gonna go around above, and it's gonna hurt. It's just like you say, if you have a cavity and you ever just like run your toothbrush on it, it's gonna be sensitive, and you're gonna keep doing that. You're trying to irritate that, 2 to 3 minutes, maybe, and you're doing this frequently. And you're just gonna rub it till it gets irritated, gets red, maybe even gets a little puffy, but I wouldn't do it for more than, a few minutes and stuff like that. And then you can go back at it again. You're just creating that irritation, and you're just, cross-fiction massage, that's what we call it. And you're just kind of getting that whole thing to kind of scar down. Now, after that, I would suggest that's when you use things like leukotape and coverall. So you're going to tape that area and then, cinch up the edges a little bit more and make that a little bit better. And you're going to go from bottom up. You've done that. Okay. So you tape that here. And then pull it up. So you want to approximate the edges and give it a good pull. So that's what we want to do, is you want to take that coverall, protect the skin, and then just pull it up, create these ripples, and that'll be the key to it healing. Let us know your thoughts on our video. Leave us some love or questions in the comments box below. Please like and subscribe. We appreciate your support. I'm Dr. Justin Lin. Remember, we heal smarter, not harder.